Hello, my name is Raquel and welcome to our video, Health Benefits for State and California State University or CSU members. If you are employed by a state agency or one of the California State Universities, then this presentation is for you. We have a separate presentation for public agency and school members available on our YouTube channel. Before we begin, let's go over a couple of housekeeping items. We've provided a presentation notes and resources document to help you follow along and reference later. You'll find the link for the document in the YouTube description box. We won't be responding to questions during the presentation due to the large number of participants. If you have questions, please contact us directly. In this presentation, we'll discuss the Health Benefits Officer and the role they play in your health benefits, health eligibility and enrollment, health plans, employer contributions, dental and vision, and then we'll conclude with some helpful resources. Let's start with who you should contact if you need assistance with your health benefits. A Health Benefits Officer, or HBO, is your direct contact for CalPERS health benefits through your employer. They provide guidance on enrollment, eligibility, and health and dental plan costs, including your employer's contribution. They help ensure your eligible family members are properly enrolled in coverage. In addition, they maintain your health benefits records and verify that all required documentation is received and on file. Lastly, they process your health enrollments and any changes you make to your coverage. While you are actively working, your employer is responsible for your health benefits, and you communicate with your HBO in your personnel or human resources office. Once you have retired, CalPERS takes over and is responsible for your health benefits. Now that you know who to contact, let's talk about your eligibility for health benefits and enrollment. While you are working, your eligibility for health benefits is based on two factors: tenure and time base. Tenure refers to the length of your appointment, such as permanent versus temporary. Time base refers to the number of hours you work in a pay period, such as half-time or full-time. To be eligible for health benefits, your tenure must be at least 6 months and 1 day, and your time base must be half-time or greater. There are some exceptions for professors in certain bargaining units working less than half-time for a California State University. If this applies to you, be sure to speak directly with your Health Benefits Officer or HBO. State Permanent Intermittent or PI employees gain health eligibility differently. If you are a PI, you're eligible for health benefits after working 480 hours during one of two control periods, January 1 through June 30, with the earliest effective enrollment date of August 1, or July 1 through December 31, with the earliest effective enrollment date of February 1. Please speak to your HBO for further information about continued eligibility. Certain family members may also be eligible to be enrolled on your health plan as a dependent. This can include your spouse, registered domestic partner, children up to age 26, whether they are natural, adopted, step, or a domestic partner's child. Certified disabled dependents who became disabled prior to their 26th birthday, you can certify them to keep them on your health plan if they are incapable of self-support and were never married. Lastly, a child who is in a parent-child relationship with you, such as a grandchild who is dependent on you for their financial support. These last two require paperwork and recertification from time to time. Supporting documentation, like a marriage certificate to add your new spouse or birth certificate to add your child, is also required to complete your request. You can find a complete list of the required documents in our Health Program Guide, HBD 120. You may have some family members that are not eligible for coverage as a dependent, such as an ex-spouse, a grandparent, or even a boyfriend or girlfriend. It is against the law to continue enrollment of an ineligible family member. If this occurs, you may be liable for all costs incurred during the ineligibility period. If you're planning to retire and want to keep your CalPERS health benefits, here's what you need to know. You must retire within 120 days of your permanent separation date. If you wait longer than 120 days after that date, you won't be eligible for CalPERS health coverage in retirement, now or in the future. A question we hear a lot is, aren't my separation and retirement dates the same? Actually, they're not. These dates need to be at least 1 day apart. Here's a quick tip. Separation date. This is your last day on payroll with your employer. It could be when you're cleaning out your desk, celebrating with coworkers, on your final Zoom call, or even using up vacation leave. No matter what, it's the last day you're getting paid by your employer. Retirement date. This is the day after your separation date or later. It's when you officially start your retirement. Maybe you're sleeping in, traveling, or spending time with family and pets. You're no longer on your employer's payroll. You also need to receive a monthly retirement allowance from a public pension system like CalPERS or CalSTRS. You need to be eligible for health enrollment on your last day of work or your separation date. So make sure you qualify for health benefits when you leave your job. The Health Benefits Plan Enrollment for Active Employees Form, HBD 12, is the form you'll use to request any changes to your health benefits. It's used to enroll in a health plan, add or delete eligible family members, change health plans, cancel health plan enrollments, or decline enrollment into a health plan. As an active employee, you may be able to make health enrollment changes online through your MyCalPERS account. This functionality is at the discretion of your employer, so please contact them before trying to make any changes online. This functionality is not available for California State University employees. When using MyCalPERS to submit your health enrollment changes, you'll see which documents are required, and you can upload them at your convenience. You can also view the status of your request at any time in your MyCalPERS account. If your employer allows you to submit your changes online, you do not have to submit the HBD 12 form. However, one thing you cannot do online is decline enrollment. If you are declining enrollment, you must still complete the HBD 12. When you are ready to retire, the continuation of your health benefits into retirement is dependent upon separation and retirement dates. If your separation and retirement date are within 30 days and you are currently enrolled in a health plan, it will automatically continue with no break-in coverage. This includes all dependents on your plan. Remember, your separation date is your last day on payroll with your employer and is not your retirement date. If your separation and retirement dates are between 31 days and 120 days apart, your health coverage will not continue automatically, which could result in a lapse of coverage. At this point, you've got 4 options. You could choose to enroll in direct pay through your employer, which allows you to pay the full gross premium directly to the health plan, request to re-enroll with CalPERS within 60 days of your retirement date, re-enroll during open enrollment, or qualify for a 90-day late enrollment, which we'll discuss later in this presentation. If your retirement date is more than 120 days from your separation date, then you are not eligible for continuing your health benefits into retirement. I just mentioned open enrollment, so let's talk about it. Open enrollment is the one time each year when you may make changes to your health benefits without what is called a qualifying event. Open enrollment traditionally is held each fall, and changes become effective the following January 1. During open enrollment, you may request to enroll in a health plan if you are not currently enrolled, change health plans, add or delete eligible dependents, or cancel your health coverage. Open enrollment materials are available in your CalPERS account. This includes information about your current plan, rates, and which plans are available to you. Retirees are able to make open enrollment transactions in their CalPERS account. For active employees, excluding California State University employees, your employer may allow you to make these changes in your CalPERS account. Check with your HBO before making any changes online. Outside of open enrollment, there are qualifying events that allow you to make changes to your health benefits. These are called special enrollments. Think of these as major life events that allow everyone to make a change. These include marriage or registration of a domestic partnership, birth or adoption of a child, Medicare eligibility, and involuntary loss of non-CalPERS coverage. Requests for changes based on special enrollment events must be done within 60 days of the event and will be effective the first of the month following the receipt of the request and all required supporting documentation. For example, if you got married on June 16 and your request to add your new spouse along with your marriage certificate was received on July 20, the effective date would be August 1. Late enrollment is another way you can enroll in a health plan or add eligible family members to your plan without having to wait for the next open enrollment. Late enrollment applies when there is no qualifying event to allow enrollment or the request for special enrollment is made outside of the 60-day period. There is a 90-day waiting period for late enrollments. The effective date is the first of the month following the waiting period. Let me give you an example. If you get married on June 16 and you are in the honeymoon phase and forget to request to add your spouse within 60 days, you then request to add your spouse on August 21. You are outside your special enrollment window, but you can do a late enrollment. The 90-day waiting period would end in November, and the coverage would be effective on December 1. There are events that require you to make a health enrollment change. These are called mandatory events and usually require a health cancellation or deletion. You'll want to notify your HBO or CalPERS promptly because these events can affect your health premiums. These events are effective the first of the month following the event and usually require supporting documentation. This can include divorce or termination of a domestic partnership, death of a dependent family member, or death of a CalPERS member. For example, let's say you're enrolled in a two-party plan with your spouse, but got a divorce in 2019. However, you did not report the divorce to your employer or to CalPERS until 2 years later. By law, your former spouse must be deleted retroactively to the first of the month following the date of divorce. Your former spouse would be considered uninsured during that time, and you may be financially liable for any services they received. There are two types of enrollments that are not permitted. These are called unlawful enrollments. The first is dual coverage. This occurs when someone is enrolled in two separate CalPERS health plans. For example, you and your spouse are both State of California employees, and you're both eligible for CalPERS health benefits in your own right. You're both permitted to be enrolled on your own plans. However, you cannot both be enrolled on your own plans and be on each other's as a dependent. That would be illegal. You are also not allowed to be enrolled on your own separate plans and cover your dependents on both. No one is permitted to be enrolled twice on our plans. However, someone can be enrolled on a CalPERS plan and be enrolled on a completely separate non-CalPERS health plan. Next is split enrollment. The most common example of this is if you and your spouse are both enrolled on your own individual CalPERS health plans as individual subscribers and want to divide coverage of your dependent children between the two of you. This is not allowed. All dependents must be covered under one subscriber. Lastly, let's briefly discuss COBRA, or the Consolidated Omnibus Budget Reconciliation Act of 1985. COBRA is a federally mandated program that allows you to continue health coverage for yourself and your dependents if you involuntarily lose your health benefits. You must submit a COBRA election form within 60 days following notification of eligibility. Your premium cannot exceed 102% of the group monthly premium rate. Coverage must be continuous, and you'll be required to pay premiums from the date your CalPERS coverage ended. If you have a reduction in work hours, are laid off, or separate from employment, you may receive up to 18 months of COBRA coverage. If you go on military leave, COBRA coverage is for 24 months. If you get a divorce or terminate a domestic partnership, get a legal separation, or your child is no longer a dependent, your former dependents can receive COBRA for up to 36 months. Your dependents would also be eligible to enroll in COBRA when you pass away, unless they qualify for continued coverage as a survivor. Now that we've provided an overview on eligibility and enrollment, let's move on to our health plans. Choosing the right health plan for yourself and your family can be a difficult decision to make, and we understand cost is a major factor. But there are other considerations, including availability of doctors and hospitals, locations of care facilities, and when you're getting ready to retire, how the plans work with Medicare. Because of these, we offer a variety of health plan choices, which are broken down into 4 plan types: Preferred Provider Organizations, or PPOs, Health Maintenance Organizations, or HMOs, Exclusive Provider Organizations, or EPOs, and association plans. I'll go over these so you have a basic understanding, but ultimately, you should do your own research by utilizing the available resources, such as logging in to your MyCalPERS account to access the Search Health Plans tool, or go to our website, calpers.ca.gov, and read through the health benefits summary, or even simply call the plans directly to get coverage questions addressed. First, we're going to cover Preferred Provider Organizations, or PPO. So what is a PPO? A PPO plan allows you greater flexibility when choosing your healthcare providers, which many members find beneficial. Key areas to remember: your maximum copay, or coinsurance, is less when you stay in-network for services. You can see a specialist and access many types of services without a referral. While you'll be matched with a primary care provider, you can choose not to go through them for care. You pay for services until you meet your deductible. After meeting your deductible, you pay coinsurance, which is a percentage of the costs. And lastly, in-network services are generally cheaper than out-of-network services. We offer the following PPOs. PERS Platinum is available worldwide. PERS Gold is only available in California. Our PPOs are administered by Blue Shield of California with prescription services through CVS Caremark. We also contract with included Health for Basic, non-Medicare subscribers and dependents. Second is our Health Maintenance Organizations, or HMO. So what's an HMO? An HMO plan includes a network of providers such as doctors, medical groups, hospitals, and labs that you must go through to receive care. Key points to remember: you'll have a primary care doctor who manages your care. If you need to visit specialists or get tests, your primary care doctor will make the referral or request authorization. There is usually a copay for most services. And lastly, an HMO has a geographically restricted service area, so availability of HMO plans is based on your home or work zip code. We offer the following HMOs. Basic non-Medicare plans include Anthem Blue Cross Select and Traditional, Blue Shield Access Plus and Trio, Kaiser Permanente, Sharp Performance Plus, United Healthcare's Signature Value Alliance and Harmony, Western Health Advantage, and HealthNet Salud y Más. While all of these plans are available in the state of California, there are two that you can enroll in out of the state. Kaiser is available in select areas in Colorado, Georgia, Hawaii, Maryland, Oregon, Virginia, Washington State, and Washington, D.C. HealthNet Salud y Más is available in northern Mexico within an approximate 50-mile range of the California border. Third, our exclusive provider organizations, or EPO, falls somewhere between an HMO and PPO. It provides the same covered services and lower costs of an HMO, along with a broad network and some of the flexibilities of a PPO. Key areas to remember: you pay copays, but you do not pay deductibles or coinsurance like you would in a PPO plan, so your overall out-of-pocket costs may be lower. You're required to obtain care from the plan's network of preferred providers. If you receive care out of network, you're required to cover the full costs of services, except for emergency medical care. And lastly, you'll be matched with a primary care provider, but you do not need a referral to see a specialist as long as they are within the preferred provider network. We offer the following EPO: Blue Shield Access Plus EPO. It is only available in 18 rural counties in California. And then there are the association plans. Association plans are managed by a safety association and are only available to dues-paying members. Because of this, even their retirees must continue to pay dues to stay in the plan. If they stop paying dues, they will be put in PERS Gold and will need to talk to the plan to see if and when they can re-enroll. There are 3 association plans available to dues-paying members of state agencies: California Association of Highway Patrolmen, or CAHP, California Correctional Peace Officers Association, or CCPOA, and Peace Officers Research Association of California, or PORAC. CCPOA is an HMO plan with Blue Shield of California administering the health plan services. CAHP and PORAC are PPO plans with Anthem Blue Cross administering the health plan services. Let's specifically talk about changing your health plan. You're allowed to change your health plan during open enrollment and with a qualifying event, including when you move, when you change employers, when you retire, or when you become eligible for Medicare. For State of California employees, changing agencies is not a qualifying event because your employer remains the State of California. However, if you were to leave state employment and gain employment with a public agency that contracts for CalPERS health benefits, this would be a qualifying event to change your health plan. Let's move on to discuss employer contributions. Your employer contributions are subject to collective bargaining, so the employer contributions and health plan rates will change calendar year to calendar year based on those negotiations. Those contributions are available on the CalPERS website. If you are an active employee with the state of California, you can visit the CalHR website, which has a great benefits calculator that provides the premium, what the state pays, and what you pay for your health, dental, and vision plans based on your bargaining unit. Now let's talk about state health vesting requirements. So what does health vesting actually mean? Basically, you need to work a certain number of years before the state will pay a certain amount toward your health insurance premiums when you retire. Now, how many years do you need to work to be fully vested? That depends on 2 things. First, your first hire date with the state of California, or CSU, and second, your bargaining unit. These factors decide how much service credit you need. Sometimes it's 10 years, sometimes 20, sometimes 25. Once you hit the required number of years, you're considered fully vested. That means you qualify for the maximum amount the state will contribute to your health premiums. But here's a common misunderstanding. Being 100% vested doesn't always mean your health insurance is totally free. Any amount left over after the state pays their share is your responsibility to pay. Usually, this is a deduction from your retirement check. What does it mean to be fully, partially, or not vested for state health benefits. Fully vested means you've worked enough years to receive 100% of the state's contribution toward your health premium in retirement. Partially vested means you've worked at least half of the required years and may receive at least 50% of the state's contribution. Not vested means you haven't met the minimum service requirement. You can still enroll in a CalPERS health plan, but you'll be responsible for paying the full premium on your own. To understand your vesting requirements, I recommend you review the Health Program Guide HBD 120 available on our website. Now let's briefly touch on dental and vision coverage. State and CSU members may be eligible for dental and vision coverage into retirement. Where you work determines who administers your dental benefits. The California Department of Human Resources administers the state's dental program. California State University, or CSU, Chancellor's Office administers the CSU dental program. The California Association of Highway Patrolmen, or CAHP, administers the CAHP dental plan for dues-paying members. It's important to note, we, CalPERS, are not a dental administrator. We handle the retiree eligibility, enrollment, and premium deductions as authorized by the administrators, while CalHR, or CSU, determines and provides open enrollment information. If you are still working and would like to make changes to your dental plan, this must be done through your employer. To be eligible for retiree dental with the state of California, you must meet all three criteria: separate and retire within 120 days, receive a monthly retirement allowance, and retire from a CSU or a state agency. You'll notice these requirements follow health benefits into retirement. So the easy way to remember it is, if you qualify for health into retirement, you qualify for dental. If you were enrolled in the dental program prior to retirement, then your employer should process the dental enrollment into retirement, but they may need you to fill out a form. If you weren't enrolled in the dental program prior to retirement, then you can enroll by contacting us within 60 days from your retirement date, and we'll enroll you. Retiree vision coverage may also be available to you and your dependents through the Vision Services Plan, or VSP. CalHR administers the state's vision care program, while the CSU Chancellor's Office administers the CSU Vision Care Program. To enroll in retiree vision, there is a form you'll need to submit to your employer. If you have any questions about eligibility, enrollment, coverage, or benefits, you should contact VSP directly. We've gone over a lot today, so let's go over our health resources. These resources offer valuable information to help you better understand your CalPERS benefits. You can find much more information about your health benefits on our website, calpers.ca.gov. We have resources for active members and resources for retirees. Some of the most valuable resources are our publications. I've mentioned the Health Program Guide, or HBD 120, a few times in this presentation. Not only does it go over eligibility and enrollment, but it also provides an overview of CalPERS health plan types and tells you how and when you can make changes to your plan, including what forms and documentation you will need. It describes how life changes or changes in your employment status can affect your benefits and eligibility. There is also the evidence of coverage publications. These are provided by each plan. They review terms and conditions of coverage, including benefits, covered services, and co-payment info. They can be downloaded or viewed on the CalPERS website. Then there is a health benefit summary, which explains differences between HMO, EPO, and PPO plans, and compares plans side by side. And lastly, your Medicare resource is our Medicare Enrollment Guide. This guide provides information on how your CalPERS health benefits and Medicare work together. Now, we didn't go into Medicare in this presentation because we have a separate video dedicated to Medicare. It's called Medicare and Your CalPERS Health Benefits. Find it in our YouTube channel at youtube.com/CalPERS. Finally, one of the best resources available is your very own My CalPERS account. In your CalPERS account, the Health Plan Summary page provides details about your current health coverage, including your current plan, premium, and dependents. There is also Search Health Plans, where you can search and compare health plans in your area, Health into Retirement Calculator, where you can find out how much health benefits will cost you in retirement, Open Enrollment, which is an annual event where you can make health plan changes that will take effect January 1 the following year, and Health Vesting, where you can see how much your employer may pay towards your retiree health premiums. Now, to close out our time, I want to mention that this presentation, along with many of our other videos, is available on our YouTube channel. You can get to it through calpers.ca.gov or by visiting youtube.com/CalPERS. Thank you so much for joining us today to review health benefit options for state and CSU members. We hope you found the information helpful. If you'd like to learn more or dive deeper, we encourage you to check out our member education classes. You can sign up for these through your CalPERS account under the Education section. Just a quick reminder, CalPERS is governed by the Public Employees Retirement Law. The details we've shared today are meant to give you a general overview, but the law itself is complex and can change over time. If there's ever a difference between what you hear in our presentations and what the law says, the law will always take priority. Later today, you'll get an email with a short evaluation. We'd really appreciate it if you could take a few minutes to share your feedback. It helps us make these presentations even better. Thanks again for spending part of your day with us. Have a wonderful day.